So welcome again. My name is Ted McCarthy. I'm a public affairs specialist in the Office of Disease Prevention and Health Promotion, or ODPHP, which is within the U.S. Department of Health and Human Services. I'm joined today by my colleagues Katie Costello and Mallory Polster, who will be sharing more information about the Move Your Way brand and how you can use it to promote physical activity. And with that, I will pass it over to Katie.
Great. Thanks so much, Ted. So welcome again, and thank you all for joining. So before we dive into the details of the Move Your Way brand, I'd first like to take a couple of minutes to share some background on the campaign for those of you who may be new to Move Your Way. So to introduce the Move Your Way campaign, I'd first like to share this short video.
What is the Move Your Way campaign? People in our communities need physical activity to be healthy. And the physical activity guidelines for Americans clearly states how much activity people need based on the latest science. But most people still aren't getting enough. And that's where Move Your Way comes in. Move Your Way is a national campaign launched by the U.S. Department of Health and Human Services to help Americans get active. The Move Your Way campaign adapts the physical activity guidelines into information everyone can understand and use, no matter their age, abilities, health status, or fitness level. Move Your Way aims to reach people who aren't active enough yet, but who are thinking of making a change. And to reach them, Move Your Way is changing the conversation about physical activity. Being active has great health benefits, but for many people, getting active isn't easy. They're surrounded by messages that make physical activity feel unachievable, overwhelming, and all or nothing. Move Your Way shows how manageable and adaptable physical activity can be, and how to work around barriers like lack of time or access to facilities. Move Your Way means lots of things count as physical activity, even everyday tasks like cleaning your house and walking your dog. It all adds up. Even a few minutes of moving more each day has real benefits. Find activities that work for you, so it's easier to stick with them. Move Your Way is ready to use with a suite of fact sheets, posters, videos, and interactive tools, tailored to different audiences like older adults, parents, kids, teens, and pregnant and postpartum people, and based on people's needs. Move Your Way materials are tested with diverse groups of people to make sure they're clear, informative, and accessible. And all materials are available in English and Spanish. Now it's your turn to move your way and get your community moving too. Find all the Move Your Way resources at health.gov/moveyourway/community resources.
And so, as this video introduced, the Physical Activity Guidelines for Americans serves as the primary authoritative voice of the federal government for evidence-based guidance on physical activity, fitness, and health. It provides recommendations for those ages 3 and older and includes information on how physical activity can help promote health and reduce the risk of chronic disease. It has recommendations broken down by different population groups. So there are recommendations for children and adolescents, adults, older adults, people during pregnancy and the postpartum period, and people with disabilities and chronic health conditions. But the physical activity guidelines are really meant for health professionals, policymakers, and educators, not the general public. And so the findings from the second edition of the guidelines are what led us to develop the Move Your Way campaign. So to understand how Move Your Way came to be, it helps to start at the beginning with the science. And so here I'll draw a parallel to the development of the dietary guidelines to illustrate the similarities between Move Your Way and the end consumer product of the dietary guidelines, My Plate, or formerly known as My Pyramid, which many of you may already be very familiar with. So the product of the dietary guidelines, or Physical Activity Guidelines Advisory Committee, is a detailed scientific report. The federal government then takes their summary of the science and translates that into policy, the dietary guidelines or physical activity guidelines, for example, which are written for health professionals and policymakers. So if you read the guidelines, they're quite technical and they're not really written for a consumer audience. So similar to how My Plate puts the dietary guidelines into plain language for consumers, Move Your Way puts the physical activity guidelines into actionable and consumer-friendly steps to help guide behavior change. So Move Your Way does this by targeting physical activity contemplators, or people who aren't currently meeting the physical activity recommendations, but who are motivated to increase their activity level in the next 6 months. So the campaign aims to help people live healthier lives through increased physical activity and understand how much physical activity they need to be healthy and how to fit it into their daily lives. And so ultimately, the goals of the campaign are to raise awareness and knowledge of the recommendations in the guidelines, build self-efficacy related to physical activity and overcoming common barriers to being active, and then to shift behavior by motivating more people to get moving. And so on health.gov, you can search through over 80 free resources like posters, fact sheets, and videos that you can distribute in your community. And Move Your Way has resources tailored to all of the audience listed here. So kids and teens, adults, older adults, people during and after pregnancy, parents, and healthcare providers. And they're all available in both English and Spanish. But we'll discuss those materials in a little more depth later in the presentation. So now that you're all a little more familiar with the campaign and its goals, I want to dig a little deeper into the development of the brand and the different elements of Move Your Way that make it effective. And so Move Your Way was first launched in 2018, and multiple rounds of research and product testing were conducted prior to its inception. And still today, research and collaboration are at the foundation of Move Your Way. So in addition to pulling from existing peer-reviewed literature, we've done our own research, collecting data from over 7,000 study participants through focus groups, in-depth interviews, and online surveys. We'll go a little bit into the different stages of research we conducted to get the campaign started now. So to start the development process, interviews were conducted with members of the Physical Activity Guidelines Steering Committee, which consists of individuals from across federal agencies, including the Center for Disease Control, or CDC, the National Institute of Health, or NIH, and then the U.S. Department of Agriculture, or USDA. And these interviews informed the development of the campaign and its associated icons. We still work with the Federal Steering Committee to ensure that the materials being developed and the research activities supporting the campaign are as strong as possible. So during the formative research stage, we surveyed over 2,000 adults to collect data on consumers' knowledge and awareness of the physical activity recommendations, current and desired physical activity behaviors, and communication habits and preferences. We also conducted focus groups with consumers and professionals, including primary care providers, personal trainers, and physical and occupational therapists, to better understand preferences related to physical activity and physical activity-related communication. So as part of the formative research, an environmental scan was conducted to explore existing icons, graphics, and imagery related to physical activity, find design and concept inspiration, and then ensure we were developing an original icon. So we looked at several concepts and themes to inform our icon, including color, style, context, interactivity, composition, and then how to clearly communicate physical activity guidance. So with the findings from our formative research, we developed a set of draft messages and graphic concepts for the campaign. So to test these, we conducted icon and message testing with consumers, professionals, and stakeholders, or external organizations that work directly with key audiences for the guidelines, to determine their preferences for graphics, taglines, tools, and then dissemination strategies related to promoting physical activity and the guidelines. And finally, as with all federal products, the campaign went through formal departmental clearance, which ensures that there is agreement and consistency across HHS. So as you can see, a lot went into the development of Move Your Way. And to give you a better picture of how we actually apply this research to the brand, we'll start by highlighting some of the key findings. So we tested 8 different icons with varying concepts and designs. We knew that we would need a really compelling icon to help translate the guidelines recommendations into practical guidance, since this icon would really be what the vast majority of consumers and even professionals see. So we first tested some icons that had a strong focus on the dosage recommendation of 150 minutes of aerobic activity per week. However, we found that participants really disliked these icons and mentioned that the physical activity and didn't like that they mentioned the physical activity guidelines in the 150 minutes. Consumers reported being confused by the Go for 150 and My 150 concepts and seemed to have insufficient information to really understand the main message. We also decided to avoid an icon that mentioned the specific dosage for adults because we wanted to have a unified campaign for contemplators, families, and children. And using the adult dosage graphic would have required a separate icon from children because their recommendations are a little different, and their recommendation is 60 minutes per week. So we also tested versions that did not include the recommendations, including the My Move and Go Your Way icons showed here. So both consumers and stakeholders preferred the word your to my and stated that my seemed exclusive or inflexible, while your conveyed a sense of choice and ownership. And also graphics with the term move tested better than those with the term go, as move had a stronger association with physical activity. We also tested various taglines that would accompany the icons, including get moving your way, just about anything counts, find your way to better health, meet the physical activity guidelines your way, go for 150 minutes of activity every week, what's your 150? And then walk, run, dance, play, what's your move? So similar to the results from the icon testing, participants did not like the reference to the physical activity guidelines or specific recommendations. The favorite by far in English and Spanish was walk, run, dance, play, what's your move? Participants consistently preferred taglines that were framed as a question, and the variety of activities given in this tagline implies that individuals have options for getting active. Providers also liked that it incorporated a variety of everyday movements. And most importantly, use of the word play was especially important because it suggests that physical activity can be fun and not a chore. So finally, 3 sets of draft messages were tested with the different audiences. So examples of some of these messages included, don't have time for a long workout, find ways to fit in little bursts of activity during your day. Try doing crunches during commercials and when you watch TV. And another example would be just about any kind of physical activity, walking the dog, gardening, or even vacuuming and mowing the lawn counts towards your goal of at least 150 minutes of moderate intensity physical activity a week. So across all of the audiences we tested these messages with, including, again, consumers, professionals, and stakeholders, we found a few consistent results. First, people want practical tips on how they can get more physical activity. Consumers already know that they need to be physically active, but what they need help with is how to do it. They want life hacks with easy ways to fit activity into their busy lives. Also, people understand that physical activity is good for their health, and the standard messages about the long-term physical health benefits of activity are uninspiring to consumers. Instead, participants really like the messages that explain the unexpected benefits of physical activity, like better mood and improved grades in school. People want to feel like they have a lot of options for how to become active. Similar to the findings from the icon and tagline testing, participants did not like messages that seemed to prescribe a specific amount or a specific type of activity. They preferred messages that presented a wide array of activities they could choose from. And while personal choice was really important to participants, they also valued group activities and messages that conveyed people getting active together. Participants were pleased and surprised to see that everyday activities can be counted as physical activity. And finally, for people to stick with an activity, they have to enjoy it. So physical activity should seem fun. And so with all of these findings from our formative research, icon, graphic, and message testing, we created the Move Your Way brand. And so in the next few slides, I'll show you what we came up with and how we applied it. So the Move Your Way brand helps people feel empowered, inspired, and motivated to find ways to tailor physical activity to their own preferences. It gives them creative yet practical suggestions and tools for working physical activity into their everyday routines. And these values serve as the foundation of the Move Your Way campaign, where we focus on making physical activity easy, accessible, flexible, and fun. And so the primary Move Your Way logos shown here, consist of various mover icons placed on top of the word move to show the wide range of activities a person can do to fit physical activity into their daily life. We also included icons showing more than one person engaged in an activity to highlight the community and family aspect of being active, like these 3 movers jump roping, as well as a mover and a wheelchair to represent inclusivity of abilities. The word your is set in a spring green color to emphasize that there are countless ways to customize your movement plan to make it your own. We took the findings from our message testing and developed key messages that aim to frame the recommendations as aspirational, not as inflexible mandates, get people to think about any movement as physical activity, and help people build confidence and feel that the recommendations are attainable. Move Your Way reframes physical activity with messages like lots of things count as physical activity, even everyday tasks like vacuuming or walking your dog. It all adds up. Even a few minutes of moving more each day has real benefits. And it's important to find activities that work for you, so it's easier to stick with them. And so overall, the Move Your Way brand is meant to be friendly and inspiring. Every design element, from the contrast of the neutral grays and healthy greens, coupled with the bright, energetic colors, to the athletic sneaker-inspired patterns, seeks to motivate folks to get out and get active. The materials are meant to be vibrant, energetic, and motivating, affirming and accessible for all people, easily recognizable, and flexible and adaptable. And so, as I mentioned, inclusivity is really at the heart of Move Your Way and its photography guidance. So Move Your Way aims to show that being physically active is for everyone. In all of our materials where we feature real people instead of our mover icons, we make sure that photos include people of diverse economic, ethnic, racial, and cultural backgrounds. Individuals represent a wide variety of ages, gender identities, body sizes, and physical abilities, so everyone can see themselves represented in the photos. Images are realistic and candid versus staged. They show activity occurring in a variety of community settings, like images of an indoor exercise class, as well as a family walking their dog at the park. Photos show people displaying safe behaviors, like wearing a helmet while riding a bike. And finally, they show a wide range of physical activities and levels of exercise equipment. We also always choose images with a clear focus, good lighting, and a strong composition. We include one or more of the Move Your Way brand colors within the photos wherever possible to increase recognizability. And primarily show photographs in full color without any color overlays or other effects to make sure we're showing what physical activity really looks like. And so to further reinforce the inclusivity of Move Your Way, we ensure our entire design approach is accessible through everything from the diverse range of backgrounds and abilities shown in the iconic figures to the campaign's logo and the diverse range of photographs. Move Your Way meets people where they are and reassures them that anyone can become more active. And in materials created for kids, you'll find these fun activity movesters, or monsters that move. And these movesters are loosely based off of geometric shapes. And as with the Move Your Way guidance for photography, the movesters represent a diverse range of body shapes, colors, and abilities. And so with all of these elements, they've contributed to the creation of Move Your Way's award-winning materials. The Move Your Way fact sheets and interactive tool have won awards for outstanding clear communication and digital health products. So when you use Move Your Way resources, you can be sure that you're sharing clear, user-centered, evidence-based information with your audiences. And so with that, I'd like to hand it over to Mallory to show you how you can actually apply all of this in your work.
Wonderful. Thank you so much, Katie. So yeah, now that we've taken a deep dive into the Move Your Way brand, I'd like to share how you can use it. And there really are 3 main options for this. So the first option, which is also the simplest, is to just use Move Your Way materials as is. So as Katie just shared, these materials have been tested with their audience. They align with the science from the physical activity guidelines, and they're tested that they include that clear and easy to understand information. So all of these resources are available on health.gov. And if you scan the QR code here, you will be taken to the Move Your Way campaign materials page. And this is where you can kind of select your audience. So if you're interested in looking at materials to reach parents or older adults, or healthcare providers, you can look at all the audiences available and go ahead and pick the population you'd like to focus on. And from there, you'll be able to explore all of the ready-to-use materials available. So you'll be able to look through a range of posters and fact sheets that explain the benefits of physical activity, how much is recommended, and include tips on how to overcome common barriers. And these are all high-resolution files that you can download and print for use, whether that's hanging a poster at your workplace or handing out fact sheets at a community event. You'll also find videos with tips on how to get moving, and these will be available in the English and Spanish options, as well as versions that have audio descriptions to make sure they're accessible. You'll also find plug and play social media graphics and messages that you can use, so you don't have to even worry about drafting your own messages. You can pull from what's already on the website and not have to come up with your own content. And lastly, you'll find our interactive tools like the Move Your Way activity planner, where people can make a personalized weekly physical activity plan, as well as the parent interactive graphic, where parents can walk through their child's day and assess how much physical activity they're getting, and then kind of find ways to incorporate more physical activity into their child's schedule to help them work up to the guidelines. The other image pictured here is the main Move Your Way website for consumers. So the Move Your Way materials point people to this Move Your Way website, where they can find all of the information in one place and explore a range of resources that are relevant to them. And if you want to take the website for a test drive or make your own physical activity plan, you can always access the Move Your Way website by visiting health.gov/moveyourway. So moving on to the second option for using Move Your Way, and this option offers a level of customization, is to use the Centers for Disease Control and Prevention State and Health Media Center to customize materials. You can add your organization's logo and contact information, as well as change the photos, either swapping in photos from your own community or selecting from one of the many photos offered by the Media Center. They can even help you add your organization's name, URL, logo, and phone number to a Move Your Way video. The Media Center staff are available for free consultations, and they can help answer questions about using the Media Center website, about finding Move Your Way advertisements that fit your program's objectives, or placing an order. You can contact them at schmc@cdc.gov, and you can scan the QR code here to see where you can view and request those materials. There is a small fee associated with the customization, and it is recommended that you plan your order in advance because it can take about 2 weeks to complete paperwork and get your logo added to the materials. This slide shows an example of how the Southern Nevada Health District used the CDC Media Center to customize a Move Your Way poster. So they added their logo and their website to the bottom of the poster, and then they swapped out this beach walk image to a desert hike image that better represented their environment. So the third and final option for using Move Your Way is to work with our team here at ODPHP to develop materials in other formats or add customizations that aren't offered through the CDC Media Center. Working with us allows for the greatest amount of flexibility and customization, and to reach out to us, you can use the Contact Us form on health.gov and select Move Your Way in the drop-down menu. And I'll show you some examples here of the great resources and materials that have been created through this process of working with us. These custom Move Your Way door decals and social media graphics were created by the University of Maryland, Reckwell. So Reckwell reached out to us at ODPHP because they wanted to adapt the campaign to be a bit more personalized to their college student audience. So with guidance from ODPHP, Reckwell made custom materials and planned a campus-wide Move Your Way campaign. Through working with us, they were able to adapt existing materials and create new materials to meet their students' needs. For example, Recwell made social media graphics that highlighted the benefits of physical activity that would really resonate with their students, like improved sleep, better focus, and decreased stress. And they also created additional materials where they were able to use photos of their own students, so photos featuring University of Maryland students engaging in a wide variety of activities on campus, like group fitness classes, swimming, throwing a frisbee, and even walking to class. And they were sure to promote these resources beyond just their campus recreation programs, where students were already involved in their programming and maybe already getting active. They really wanted to make sure that they reached all students and that they encouraged more students to use their resources. So they hung posters on campus shuttle buses and also in residence halls. Another example here is from Austin Public Health. They recently worked with us to develop signage for exercise stations located along walking trails. And these signs educate community members about the guidelines and also point them to local areas and spaces where they can get active. And then after developing these signs, they worked on a Move Your Way event at a City of Austin park to introduce the community to Move Your Way and also introduce them to the different exercise stations located around the walking trails. The South Dakota Department of Health's Office of Chronic Disease Prevention and Health Promotion reached out to ODPHP because they wanted to tailor the campaign to South Dakotans, and they wanted to really lead a Move Your Way implementation across the entire state. So they worked with ODPHP to develop their own South Dakota playbook that combines existing content and implementation guidance from the Move Your Way community playbook with resources and information that are specific to South Dakota. So for example, the South Dakota playbook builds on the Move Your Way playbook's tips for partnering with schools, worksite wellness programs, and community-based organizations to add tips for partnering with South Dakota tribal communities. So now they have a playbook that gives professionals across South Dakota everything they need to bring Move Your Way to their communities. And they're working to distribute this playbook to their partners alongside Move Your Way displays and materials that their partners can use at county fairs. Here you can see some examples of customizations from the Siouxland District Health Department. On the left side, you can see examples of Move Your Way signs that they placed on local trails where they encourage people to share selfies on social media with the signs found along trails to win prizes as part of a virtual scavenger hunt. Next, you can see an example of a Move Your Way giveaway bag they created. They used the Move Your Way materials for the pregnant and postpartum audience to provide over 2,000 Move Your Way bags to healthcare providers and women's health care facilities. And each bag included a Move Your Way fact sheet, as well as a water bottle, onesie, and exercise band with the Move Your Way logo. Lastly, they installed a bench workout sign to encourage physical activity near park benches, and they added permanent trail signage explaining the physical activity guidelines and noting how many miles and minutes are remaining at different points on trails. Here are just a few other examples of some of the different types of materials created in collaboration with ODPHP. These include giveaways like frisbees and water bottles that are distributed to community members, these physical activity bingo cards, a Move Your Way 5K starting line pop-up, and an example of an event flyer. This was for an event that the Fairfax County Park Authority was planning, a Move Your Way Day where all local rec centers were set to be free and open to the public. So these are all just a range of some of the great examples of materials that were created through working with ODPHP. So to summarize, I want to reiterate some do's and don'ts of the brand use and the campaign use. And the do's are really the three options we just covered. So do use existing materials as is. They are designed and tested to reach their intended audience and can be a great complement to your existing educational materials. Do use the CDC State and Health Media Center for minor customizations like adding your organization's logo or swapping photos. And lastly, do reach out to ODPHP if you want to create custom materials like this flyer here on the right, and we will work with you to support your use of the Move Your Way brand. And if you're not sure what would be best for your organization, or if you're already using Move Your Way, we encourage you to reach out and we would love to meet with you. And for some don'ts, we've made an example here of a material that was created without working with ODPHP. So I'll run through some of the don'ts, some of the common mistakes here. So on the top left, the organization changed the Move Your Way logo and tagline to Move Your Way, Exercise to Stay Healthy. So this really works against that goal to help shift the mindset and help people understand that physical activity can include more than just traditional exercise. In the middle, they changed the recommended amount of physical activity to 30 minutes, 5 days a week. And although 30 times 5 adds up to 150 minutes, that's just one way to meet the aerobic guideline. And people don't need to be physically active for 30 minutes at a time for it to count, right? They can work towards that 150 minutes in whatever way works best for them. And even a few minutes of physical activity can count towards that 150 goal. Additionally, this material only includes the aerobic recommendation, so it's completely left off that muscle strengthening recommendation of at least 2 days per week. Next, this graphic uses a photo that doesn't align with Move Your Way's inclusive photo approach. And then lastly, and most importantly, this organization added the Move Your Way logo and icons, all without working with ODPHP or through the CDC State and Health Media Center. So if this organization had reached out to us and shared this material, we could help ensure that the material both aligns with the science from the physical activity guidelines and the inclusivity of the Move Your Way brand. So before we take questions, I want to highlight a few additional resources here. The first is the Move Your Way Community Playbook. I mentioned this earlier when we were talking about the South Dakota playbook that they created. Today's webinar really focused in on the Move Your Way brand, but less on the many events and activities that you can lead in your communities to implement Move Your Way. So if you are interested in learning more about opportunities to implement the campaign in your community, you can find all of the tools and resources that you need to get started in the Move Your Way Community Playbook. One of the great things about the playbook is that you can use the entire resource from beginning to end, or you can pull out the resources that are most helpful to you and your team. No matter the size of your team, your budget, or your community, you can implement Move Your Way in a way that works for you, whether that's just sharing some of the materials at an event or a broader community initiative where you're hosting many events, incorporating Move Your Way into your physical activity programming, and even developing built environment initiatives to help make it easier for people in your community to get active. The playbook includes resources and tips like how to connect with local partners and find new ways to collaborate, how to secure funding and leverage existing community resources, how to engage with community members through events and social media activities, and of course, how to evaluate your activities to improve your future physical activity initiatives. And there are a ton of great resources in the playbook, so I really encourage you to just look through and see what might be helpful to your organization and your efforts. So you can scan this QR code here, and we'll also put the link in the chat to access all of the Move Your Way resources we've discussed today and more. So this includes all of the campaign materials, the community playbook, and also a partner promotion toolkit, which gives you tips on how to promote the campaign to your networks and provides you with tools and resources to support this, including videos, social media graphics and messages, pledge sheets, and web badges and widgets, where you can actually embed into your website a tool that will take people to the Move Your Way website or to the activity planner. Last but not least, please get connected with us and stay in touch. You can follow ODPHP on social media at health.gov and on Facebook at health.gov. And as we mentioned, you can contact our Move Your Way team at ODPHP by using the Contact Us form on health.gov. And you can also scan the QR code here to sign up for all of ODPHP's physical activity email updates. So if you're signed up for that physical activity listserv, you'll receive all the updates about the physical activity guidelines, all of the updates related to the Move Your Way campaign, like if there are new resources available, and any opportunities related to Move Your Way. So with that, I will go ahead and turn it back to Ted so that we can take some time to answer your questions.
Excellent. Well, thank you so much to both Katie and Mallory for presenting just a lot of great information there. And getting into some of the questions that our participants shared in the chat. Jean would like to know, do our assets need attribution?
Yeah, that's a great question. So if you're using a Move Your Way material as is, handing out a fact sheet or have customized material through CDC Media Center, that's kind of all covered. If you're creating something new or have pulled something kind of out of a fact sheet into somewhere else, that's where some of that broader customization is that we want you to work with ODPHP for. Move Your Way and its logo are registered trademarks. So you will need to work with us to develop any materials that are not already available on health.gov. But we encourage this kind of use and are really always excited to work with new organizations. And when you reach out to us, we'll set up a meeting to kind of learn more about how you'd like to use the campaign, what you're trying to create, and make sure that you have permission to move forward. Several organizations have had formal partnership agreements with us, which allows for the most flexible use, but this is sometimes determined on a case-by-case basis, depending on your plan. So once we meet with you, we'll recommend the next best steps, but you may see some Move Your Way materials out in the wild, and you may see a disclaimer at the bottom that these are registered, trademarks, they're used with permission, and that's a sign that that organization has worked with us to customize those materials.
Excellent. So next question is from Kathleen. She says, we have a plethora of free resources that we can send out monthly, including monthly calendars that link to YouTube videos of 3 to 5 minute breaks. Can we make custom materials to send them out?
Yeah, so that sounds great. And what I would say is kind of just what Mallory said. I would recommend reaching out to us. We can help you kind of structure those videos or determine how best to create those using our logo or any of the resources that we already have available.
And
that
if
would be
you
great.
are, yeah, and if you're ever looking for newsletter content and you just want to link out to an existing Move Your Way video and incorporate those, that's absolutely something you can do without reaching out to us. Any use of kind of anything that's available on health.gov, we definitely encourage.
Cool. I actually like this next question. Is there an app for Move Your Way?
So we do not currently have an app. That would be wonderful if one day we can develop one, because I do think a lot of these resources would be really great on a mobile application. We do have, like Mallory mentioned, the consumer microsite. So that's a little more audience consumer facing. So that's what we recommend you linking to when you're sharing these resources with, the general public, because that is a little more interactive and easier to navigate. So that's what I would recommend until, maybe one day we do have an app, but everything you need would be linked there to share with your consumer audience. And Mallory, go ahead.
Yeah, and we do test to make sure that our activity planner and those interactive tools work on a computer browser as well as on mobile and are fitted nicely to a screen where they're not overwhelming. So that's definitely, we encourage mobile use, even if it's through typing health.gov/move your way into the browser.
Next question is from Jose. Can we go through the ODPHP to get merchandise or swag for events?
That's a great question. Definitely all the examples that you saw there, we're working with ODPHP for those organizations to develop those materials. ODPHP does not have our own swag offerings that you would purchase through us or anything like that. But if you are wanting to make Move Your Way swag for events, giveaways, things like that, please definitely reach out to us and we can help coordinate with you and give you the files that you need to make those products.
Right. Next question is from Amy. She says, do you have any advice for individuals who want to help promote physical activity but may not be connected with a local organization or know of any doing this kind of work?
That's a great question. I can start, and Katie, you can add more too. We definitely, there are organizations championing this effort, but also individuals who are passionate about promoting physical activity. We do have a lot of partners that we've worked with in this space across the country. So one, I would say, please reach out to us and we might be able to connect you with a local organization or coalition that we're familiar with that is doing this work. So that's one part of it. The other piece is that if you look through the community playbook, you will probably find a lot of different resources and tips that are relevant for an organization or for an individual. You could still be the driver to build a team and build your partnership to lead an implementation in your community. And there are tips for reaching out to organizations for, even sample pitch language already written for you for, I want to lead a Move Your Way campaign here in this community. Do you want to get involved? So I definitely encourage you to explore that. Katie, anything to add?
Yeah, I mean, that's a great example. Those are definitely great examples. And I would say it could even be as simple as sharing these resources with your family members or your friends or just people around, your own workplace, and just getting them to start using the materials or resources. I mean, I know with my family, they don't know what the physical activity guidelines are. They don't know the recommended amounts, but my mom's a teacher and I shared all of our Move Your Way kids and teens materials with her. And now she's hanging those posters up in her gym and sharing the resources with her parents. So I think it can start even as simple as that, as just kind of sharing it with your bubble and then seeing how it can spread out from there. So there are definitely lots of ways to use Move Your Way, even if you're not formally connected with an organization or coalition.
Great. Our next question, excuse me, our next question is it against the rules to add a logo and contact info to materials via a sticker?
So if you're just looking to add your contact information and logo, I would encourage you to work through the CDC Media Center. That would probably be the easiest way. Any sort of altering of the Move Your Way material and customization would be something that you'd want to do through the Media Center and with us. But if you're, at an event and you're sharing Move Your Way flyers and have other, business cards or things to share your contact information, or if you've shared, a social media graphic on social media and you in the message have the information for your organization, as long as there's no altering to the Move Your Way material, you don't have to use the Media Center or us. That's just for any customization.
Right. Next question is from Jim. He says, this is exceptional. Thank you, Jim. Do you have a next phase for Move Your Way on the drawing board?
Yeah, that's a great question, Jim, and definitely appreciate the feedback. So we had started with a community piloting phase, and so that we did that from 2009 to 2021. And that was kind of how we got started to see if Move Your Way was actually working. And we worked with, I think, 8 communities to start with, and then expanded from there. So that was kind of our initial piloting phase. And so now that we've kind of done that, seen how Move Your Way works out in the wild and kind of how it can be implemented, we're now in that sustainability phase. So we're looking to work with organizations and individuals such as you all on this call today to really start spreading the word about Move Your Way, getting other organizations to implement their own Move Your Way campaign, and kind of for you all to just kind of take these materials and use them as you see fit in your community and adapt them to your audiences. And so we're here to support that, but what we really want to see in the long term is just organizations being able to take these materials and kind of create their own campaigns on their own. And Mallory, I don't know if you have anything you wanted to add there.
No, I think you've covered it in terms of the history there. We are really wanting to support organizations in doing this work, and also help organizations connect with each other and learn from each other. So we are looking forward to opportunities to do that, to make some collaborative groups where people can be sharing their own best practices and their use and what's working for them to promote physical activity in their community. So we're excited for this next chapter. Thanks for that question.
All right, next question. Do you plan to provide the materials in other languages?
That's a great question, and one we get pretty often. So all of our materials are currently available in Spanish, and that includes, like Mallory said, videos, social media graphics, fact sheets, posters, all of that. And so there are no plans on our end to kind of translate these into multiple languages, just due to funding and resources and all of that. But that's where working with organizations such as you all come into play. If you're interested in translating these materials into another language, please reach out to us, work with us, and we're happy to help you do that to best fit, your audience and whoever you're trying to reach.
All right, next question is from Caitlin. She says, is there a database of the evidence-based research that was used to create the campaign?
That's a great question, and I can tie it in with another question about, surveillance and traction of increase in physical activity. So we do have some publications out there related to Move Your Way, and we can put those in the chat. There are two that include the findings from the research and the initial development of the campaign. There's another that's specific to some of our additional materials we created for the pregnant and postpartum audience. So we are definitely trying to get those findings out there. So we will share those either in the chat here or with the follow-up materials from this webinar. And we also have been evaluating the campaign itself and have some publications on that. And we actually did a deep dive in those evaluation results in a webinar earlier this year. And so we'll put the recording there as well. But at a high level, we were able to do an outcome evaluation and kind of compare in communities that were implementing the campaign, people who were exposed and unexposed to Move Your Way. And overall, those who reported being exposed to Move Your Way were more aware of the physical activity guidelines. They were more likely to know the correct dosage recommendations. They had built their physical activity self-efficacy. They were really more confident in their ability to be active despite common barriers. And they were also more likely to increase their physical activity in the next 6 months and to have increased their physical activity in the past 6 months, as well as to have met the muscle strengthening recommendation. So was great to be able to evaluate the implementation in communities with those outcomes and be able to do a whole deep dive webinar on that. And then also in terms of national surveillance, we do have Healthy People 2030, and we can add that to our list of resources as well. And there are objectives tracking physical activity surveillance at the national level. And so there are objectives for, the aerobic recommendation, for the muscle strengthening, and the combined for all the different populations. So that is a great tool to use to see kind of that national benchmark and trends over time.
Great. Next question we have looks like from Lauren. She says, in looking through some of the materials, admittedly not all of them since the resources are robust, are there any resources for caregivers or direct support professionals already created?
Yes, that is a great question. So our, materials that the audience is professionals, those you'll find under our healthcare providers section of the audience. You'll see those are, the reader of the fact sheet is the healthcare professional. So it might be, a doctor reading this, or for our most recent edition, which is focused on older adults, it might be a physical therapist that's working with an older adult, or another provider. Definitely, if there is a resource that's kind of more tailored to a specific audience, the healthcare provider isn't a perfect fit and you're really looking for something that's specific to a caregiver that isn't offered, that's something we would definitely love for you to reach out to us about, and something that we could potentially work together on to create, a resource that better meets your needs.
Great. Looks like we have a follow-up question from Jose. Are you aware of any Move Your Way supporters working with a CalFresh Healthy Living program in California? Shout out to California.
No, I'm not aware of any partners working with that program, but we would be happy to work with you all if you have interest in using Move Your Way or expanding that into those programs.
All right. Next question is from Jane. She says, are you aware if churches have used your materials? This might fit for our church's health and wellness ministry.
I am glad you brought that up because I think that's been kind of a major goal of this stage of at the campaign. We think churches would be the perfect setting for Move Your Way materials because it is such a trusted place. People at church are your trusted messengers. So we would really love to work with you all to get Move Your Way materials into churches and to be used there because as far as I know, it's currently not being used in churches. So please reach out to us, Jane, if you're interested in doing that.
Yeah, we know the faith-based setting is an important one for physical activity promotion. And we definitely, there's no sector of society that we don't want Move Your Way infused in. So definitely there is space there for us to grow. And we hope you reach out to us.
Awesome. So next question we got is, what's the difference between exercise and physical activity? Why does Move Your Way focus on promoting physical activity?
Yeah, great question. So exercise is really a form of physical activity that is planned, structured, repetitive, performed with the goal of, of improving health and fitness. And although exercise is definitely a form of physical activity, not all physical activity can be categorized as exercise. And exercise is really only kind of one way to meet the guidelines, but it's definitely not the only way. And so in general, people really do know what exercise is, but when it comes to physical activity, I would say that most people have a very narrow and limited definition of it. And when most people think about physical activity, they think of exercise and usually in a setting designed for more exercise like a gym. And many people think about physical activity with that no pain, no gain mindset. And so I feel like when people hear the phrase physical activity, they're picturing this high intensity workout, exercise, thinking of people sweating, feeling the burn, and exercise for a set amount of time, like 30 minutes. But for many people who are not meeting the guidelines, I would say this interpretation of physical activity can be really overwhelming and even prevent them from taking, really just small steps to get more active. And so that's why we try to focus Move Your Way on physical activity and messages that help people understand that lots of things do count as physical activity. And even a few minutes of moving more is beneficial. Even 5 minutes each day is really great and is better than nothing. So that's why we really are trying to change the conversation in this way and kind of help people build their confidence and motivation to get active. So we try not to use exercise and physical activity as an interchangeable term. We kind of keep them separate and really focus on that use of physical activity. And that's why in that example Mallory showed of, do not example where the tagline was changed to, exercise to your health. We really try not to use exercise. We try to really focus on physical activity.
Next question looks like it mentions on your website there would be a small fee to add a logo to the fact sheets. Could you ballpark that small fee?
Yeah, so this small fee is when you are doing customizations through the CDC State and Health Media Center. And the costs really vary depending on, if it's a ad that needs to be re-narrated or, if the media center is creating content to add or if you're providing it. And it can even vary based on the number of characters and font size of what you're adding. But if you contact the media center, and we can put their email in the chat again, they can give you an estimated cost for your ads and materials.
Let's see. Next question. So next question says, you mentioned that consumers reported being confused by the quote, go for 150 and my 150 concepts during the icon testing stage because they may not have had sufficient information to understand the main message. Can you elaborate on why that might be?
Sure, yeah. So some previous studies have shown that really a small percentage of the general public, specifically adults, are aware of the physical activity guidelines for physical activity, and then even less, about 2.5% of adults are actually knowledgeable of the recommendations. So meaning that they know how much physical activity they need each week, which, just to clarify, is at least 150 minutes of moderate intensity aerobic activity per week, and then at least 2 days of muscle strengthening activity per week for adults and older adults. So because knowledge of the guidelines is so low, those icons and taglines didn't really resonate with consumers in the way that the other more general icons and taglines did. And so ultimately, the purpose of Move Your Way and our messaging is to get people to increase their physical activity in any way and in any amount, because any amount of physical activity is a good thing. But this is also why, increasing awareness of the guidelines and knowledge of the recommendations are really our key goals of the Move Your Way campaign, or some of our key goals of the campaign. So that's kind of why I think consumers didn't completely understand that 150 kind of being thrown in there, just because of that low awareness and low knowledge.
All right. And I think that wraps all the questions that we have received. We have had several people asking for if we can put back up contact info to get in contact with ODPHP. So can we throw that up on the screen, please? Excellent. So hopefully everybody can see that slide that's up on the screen about following us at health.gov on Twitter or X, and health.gov on Facebook. Just want to quickly remind everybody before we wrap up today that there will be a post-webinar survey that gets sent out. We would really appreciate it if you found this at all helpful or interesting. Please do take that survey. And again, we will be reaching out with a recording of this for everybody's reference after the fact. So thank you again to Katie and Mallory. Thank you everybody for attending, and we hope you have a great rest of the day.
Thank you all. Thank you, Todd.